Have you ever wondered why sometimes patients don't tell nurses the truth? You'd be surprised how often it usually happens in the hospital. And the reason behind this might shock you. As a nurse, we rarely, sometimes, I can say that sometimes we rely on what our patients are telling us to guide us on their care. But the reality is many patients hold back information or even lie. Sometimes these small details, others it might be something that could damage their entire plan of treatment or diagnosis. But don't know, sometimes they don't know that it can affect them directly. So here are some reasons why patients don't tell the truth. Number one, fear of judgment. Many patients worry about being judged for their lifestyle. Example, someone refusing to admit that they are drinking alcohol or they are smoking, or sometimes they are not taking their medication as prescribed. You know, if you're not taking your medication as prescribed, you might get complication. You might get resistant. You might not even might not go of judgment can lead to that. Patient not telling you the truth. Number two, embarrassment. Some topics feel too personal or embarrassing to talk about, especially when it comes to sexual health, mental health, or even money issues. It might feel embarrassed if they talk about something like that. Like, for example, men don't like talking about health. They can have problem with their sexual and they fear talking about it, so sometimes they lie. They'll just lie or say something that is not related to what you want to hear. Three, or fear of diagnosis. Sometimes patients are scared of what the truth could mean. They don't want to hear bad news, so they play their symptoms. They sometimes someone is bleeding, maybe vaginal bleeding, and they are what is not happening. Maybe they are telling you, I'm just having a vaginal discharge. Vaginal bleeding is different from vaginal discharge. So sometimes you're if it is, maybe you are asking questions about how of the vaginal discharge, does it smell? And sometimes if they are having a vaginal discharge that is smelling, if you ask them, they are not telling you. So they fear diagnosis. They think that if I tell you, or if they tell nurses that they are having maybe a smelling vaginal discharge, they are going to maybe it is an STI, and it is embarrassing. Thing is lack of connection and mistrust. If patients don't feel a bond of trust with the nurse, they might not feel safe enough to open up. So communication, they will end up lying, they will end up just downplaying about something that you are asking about them. Another thing is cultural and social belief. In some cultures, certain illness or habit carry stigma. If a patient comes to you, maybe you are asking them something related to STI, they might not tell you the truth about what is going on because they feel that they will face stigma when they go back home, or if people know that they are having STIs, yeah, sexually transmitted diseases. This makes patient more likely to hide from the truth. Comes when a patient hide the truth, it can delay diagnosis, it can lead to wrong treatment, or their lives at risk. For example, if a patient doesn't admit they are not taking their blood pressure medication as prescribed, the nurse might think that the drug they prescribe is not working and change the prescription. And the truth is, this patient is not taking the drug as you prescribed. Should encourage honesty. What you're supposed to do, you must build trust, show compassion, and avoid judgmental language. Someone is telling you that vaginal discharge, and you're just already judging that person. You're sleeping with so many people. They will not tell you the truth. Another thing that you're supposed to do as a nurse, ask open-ended question. Instead of asking question which needs yes or no answers, you can tell someone is you're asking question about ask this person, can you tell me how about you are taking can you tell me more about how you are taking your medicine? This will get information you want to know about how this person is taking medicine or how this person is taking their treatment. Create a safe environment. Their information are confidential. Don't just be there trying to give the and make that what they are telling me is not they somewhere, or what they are telling you they will reveal, or you are going to reveal it to other people. Empathy. Let patient know you understand their struggle. These small approaches can make patient feel safe to share their truth. The reason patients don't always tell nurses the truth is not they want to be difficult. It is usually fear of embarrassment, lack of trust. As a nurse, just to provide care, but not to create environment where honesty feel, but to create environment where honestly feel safe. It's the first step towards healing. I want to tell you is that if you find this helpful, share it with your fellow nurses or healthcare workers, and let the conversation going in the comments. What is the most surprising thing a patient has ever admitted to you after holding it back? Tell us so that we know. What is that one thing that a patient has ever tried to back, and at long last you and came to find the truth? Tell us in the comment section.